Do you know why private hospitals simply cannot help us cut NHS waiting lists? Here is one simple reason. Spire Healthcare is the biggest private hospital chain in Britain. They have 39 hospitals. Last year, 2023, they treated a whopping 1 million patients in their hospitals. Do you know in what time the NHS treats 1 million patients? In 36 hours. They treat in 1 year what the NHS does in 36 hours. Private hospitals simply will make no difference in cutting NHS waiting lists. The only difference that using them makes is in their bottom line. For the past year at least, Wes Streeting, the Shadow Health Secretary, has insisted that in government, the Labour Party will use spare capacity in the private sector to cut NHS waiting lists. Here are 3 reasons why the private sector cannot help us cut NHS waiting lists. Number 1, the private sector does not have A&Es. How can they help us cut NHS waits in A&E if they don't have A&E? Number 2, private hospitals don't have their own doctors. They leech off doctors who are trained using public funds by the NHS. Part of why the NHS waiting list is so big is that we have 150,000 staff vacancies in the NHS. How can we fix these huge NHS backlogs if we cannot train more NHS doctors? But how can we train more NHS doctors if we are outsourcing the very kind of simpler, more straightforward surgeries that the NHS usually uses to train its doctors? Number 3, the private sector does not treat everyone. They cherry pick the simplest and most profitable cases, which means they put their own profitability above your care and helping cut NHS waiting lists. Share this video to your friends, family, and to your local Labour candidates and demand that they share this message with Wes Streeting, asking him to commit to funding the NHS properly instead of handing public money to private hospitals.